Welcome to Robert Wood Johnson University Hospital, Somerset's HealthTalk. I'm Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group's Warren Internal Medicine. In accordance with social distancing due to the COVID-19 pandemic, I am hosting this show from the studio, and our guests will be joining us remotely via video conferencing. About 20 million women and 10 million men will suffer from an eating disorder at some point in their lives. If untreated, eating disorders can cause life-threatening consequences. They have the second highest mortality rate among all mental health disorders. Early intervention is key to recovery. On today's show, we will learn more about recognizing the signs and symptoms of eating disorders, how to get help, and the services available at Robert Wood Johnson University Hospital, Somerset, which has one of only 2 inpatient eating disorder programs in New Jersey. Joining us today are our special guests, Jill Rachel, an occupational therapist with Robert Wood Johnson University Hospital, Somerset's Eating Disorders Program, and Lynn Corey, a licensed clinical social worker with Robert Wood Johnson University Hospital, Somerset's Eating Disorders Program. Welcome to the show. Jill, can you tell the audience a little bit about yourself, your background, and a little bit about why you joined the eating disorder program at Robert Wood Johnson University Hospital, Somerset? And then after that, we'll have Lynn do the same thing.
Yeah, sure. So my name is Jill, and I'm actually the occupational therapist at Robert Wood Johnson's Eating Disorder Program in Somerset. It's a unique role because typically people know occupational therapy in terms of like physical rehabilitation. On the eating disorders unit, my role encompasses a whole person evaluation. So we might look at the physical aspects, but the biggest focus is being able to help our patients develop the different skills and strategies that they need to be able to engage in daily life. My focus is on the things that they really love to do, the things that they need to do, whether it's going to school, taking care of their children, and ensuring that they're able to do that. I also work very closely with any patients we have that have more sensory-related issues with food, and we could talk more about that later.
Okay, and Lynn, a little bit about yourself.
My name is Lynn. I'm the clinical supervisor of the eating disorder unit. Pretty much, I supervise all the clinical aspects of the program. I've been with the eating disorder program here at RWJ for 19 years. So I've really seen it grow and mature and to be the excellent program that it is today. So we'll get into some of the specifics of what we do here, I'm sure a little bit later. And that's it.
Thank you both for being here. What Robert Wood Johnson University Hospital in Somerset has that very few other organizations in this New York metropolitan area have is this eating disorder program. As the supervisor, can you tell us a little bit about the eating disorder program itself, who it's made up of, what their roles are, so that people understand what the eating disorders program is and how good, convenient, and how well run this program is?
Oh, absolutely. We are only one of 2 in the state of New Jersey that have an inpatient eating disorder unit. And we also have a partial and an intensive outpatient program. So those are our 3 levels of care. We also recently have been doing telehealth to help serve as many people as we can and to help them into recovery. Part of the team consists of therapists. We have also medical people here, doctors, dietitians, Jill OT, adjunct therapists. We also have, the nurses who care for the patients. So it is a completely multidisciplinary approach to treatment. And we really encompass everything. Being hospital-based, we're able to take very ill patients and bring them into recovery and to be able to step down.
Now, can you tell us also the most common types of eating disorders that there are and the ones that we treat at both the inpatient eating disorder program as well as the outpatient eating disorder program at Robert Wood Johnson University Hospital, Somerset?
The most common 2 types of eating disorders is anorexia and bulimia. But we also treat binge eating disorder, And also there is a kind of middle type of eating disorder where they don't exactly fit into anorexia or bulimia, which is considered other specified or unspecified. And that's also treated here. Also binge eating disorder and ARFID, which is avoid restrictive food intake disorder.
Okay, and the physical signs of someone with it, just so that the general public knows, because a lot of people do really try to hide what they have.
Sure. Well, with anorexia, it is restricting your food and really would result in rapid weight loss. And bulimia is a combination of binging and purging. The purging can be in many different ways. Binge eating disorder would be overeating to excess. Okay. And then ARFID, Jill can talk to you a little bit more about ARFID. She works with a lot of our ARFID patients, and it's more of a avoidant restrictive type of, where they avoid certain foods, they restrict some certain intakes, a lot of sensory issues that go on.
So we'll start off with anorexia. Again, that's that person who basically is refusing to eat very much, barely being able to maintain weight, or they've got a lot of weight loss, leading to muscle ache, muscle weakness. They're fatigued all the time because they're not getting what they really, the nutritional value of anything that they're really eating. The bulimia, they're eating, but then they're purging. So as a physician, what they may have is they may have reflux. They may have a lot of acid type of things going on in their mouth, their throat. They may have a chronic cough. And they also, when they go out to eat with the person, what you have to look at is, are they immediately going to the bathroom afterwards to try to purge what they've eaten? So psychologically, there's a lot going on there. The other type of things that, it's happening all the time. Unfortunately, due to magazines, newspapers, due to Kardashians on TV shows and things like that, people, unfortunately, are expecting to be the super thin model. And when they go sometimes to practices, etc., they're the people almost emotionally say to them, why are you more weight than you should be? So a society is pushing some people to become more anorexic, bulimic in order to meet what they consider normal, which again will lead people to needing either the inpatient eating disorder program or the outpatient eating disorder program. Now, how do we decide which one the person belongs in?
Okay, when a person contacts us, they're set up with an evaluation appointment, and they come on in and they meet with a psychiatrist who evaluates the severity of their eating disorder, and based on the severity of their eating disorder and medical complications that can arise, they'll be determined on whether they need an inpatient stay or they can go to partial or IOP.
Okay, so if it's an inpatient stay, what do you think the approximate number of days in the inpatient stay is?
Sure. Well, it really depends on, everybody is different. It really depends on how severe that they come in on, which means that if a person coming in is 50% of their ideal body weight, they will be here for a long period of time. If they come in at, let's say, 80% of their ideal body weight, then the stay should be anywhere from 2 to 3 weeks. If a patient comes in with a diagnosis of bulimia, the normal hospital stay for that is anywhere from 7 to 10 days.
And then afterwards, how long do people remain on the outpatient program for?
Again, it's extremely customized. We really look at the patients and see their needs. What we usually do is have them come to our partial program for at least 2 weeks at 5 days a week. And at the end of the 2-week mark, we kind of reassess. We see how they're doing. Are they completing their meals? Are they behavior free from restricting or purging? And then what we can do is start to take them down in days and start to titrate them, where we give them more more support for themselves and less on us, so they can really start to assimilate back into their lives and back into them having the accountability to do what they need to do to get into full recovery.
Interesting, and we have a whole gambit of people who are following them, both as an inpatient, as an outpatient, reassessing them
Correct.
Constantly all the time.
Correct, and the same type disciplines are also available in our partial and in our IOP program.
Now, Jill has an interesting perspective, it sounds like, because rarely do you hear an occupational therapist being part of the program, and it sounds like you have an interest in that other type of eating disorder also. So, one, do you want to tell us a little bit about what that eating disorder is? And two, the role of an occupational therapist, which again, very different than many other programs, and how wonderful it is to add that to our full gambit of professionals taking care of our people at the Robert Wood Johnson University Hospital Somerset Eating Disorder Program.
Yeah, absolutely. Occupational therapy, I'm a little biased, but I do think it's one of the greatest professions, and it's definitely what makes our program unique, because it's not something that you typically see. Working on nutrition is very important. Addressing the underlying emotional, maybe family issues that cause this, very important. But what we tend to forget about is that these people have to go back to their lives and be able to function. They have to go back to school and work. They have to, if they're a parent, they have to care for their kids, a lot of things that they have to return to. And we can't just expect them to be able to get dropped back off into the world and do that. So we really work on building different skills and strategies to make that happen. Now, speaking about ARFID, what Lynn had touched on earlier, this is the type of eating disorder that most people are not familiar with. There's a lot of other different reasons that people might struggle with eating, completely unrelated from body image. So just because somebody doesn't have a body image issue does not mean that they don't have an eating disorder. An example I could give you is maybe somebody had a traumatic experience with choking, right? So perhaps that caused them to switch to a complete liquid diet. There's no way to get all of your nutritional needs met on a liquid diet. So maybe they experience rapid weight loss, but they're so terrified to reintegrate solid food. That would be covered under the ARFID umbrella. Individuals on the autism spectrum often have a lot of sensory-based eating issues. Even people that don't have autism, sometimes people are more sensitive to different tastes and textures, resulting in a very minimal amount of food intake, very few things that they're agreeable to eat. So our program, having an occupational therapist here, really allows those patients to flourish and to get the opportunity to expand that variety, to be able to not fear food, especially because the consequences of anorexia and bulimia can be the same for ARFID.
So that's interesting what you said, the fear of food.
Mm-hmm. Mm-hmm. Not everybody enjoys food. It's crazy to think, right?
Well, there are people who sit down and eat and enjoy the meal that they're eating, and there are other people who just sit down and do it because they have to do it.
Exactly. Yeah.
So yes, especially what you were talking about, the consistency. Even with people not in the eating disorder center, when we've had them with J-tubes in because they haven't been able to eat, and then we start adding things like Thicket to the liquids in order for them not to aspirate it, they also have an aversion to food itself, and it's sometimes very hard to convince them to move to the next step. And usually the help of a good occupational therapist doing speech therapy, doing swallowing therapy really does help get them over those humps. And I assume you're doing the same type of thing at the eating disorder center.
Yeah. And, it's great because being in a hospital-based setting, we do have access to our speech and language pathologists who can help to determine if there is an issue with swallowing. Is there a barrier that needs to be addressed, or can we move forward and start to trial different foods? So really working with all disciplines, ensuring patient safety is number one, allowing them to feel in control and feel really empowered when they're able to add new things into their diet.
There's nothing as good as having that video swallowing study versus versus a barium swallow. At least you can watch to see that the food goes through the multiple stages and that their tongue moves correctly, their swallowing mechanisms move correctly. And it's great having that occupational therapist then help me interpret it and help me figure out the right way to treat the person.
Yeah, it's a very delicate process of adding different foods, especially with aversions and more sensory related issues. You can't just say, all right, you're good, try stuff. So it's so important to have this unique approach. It needs to be very tailored to each individual. It's definitely not something that could be done just at home by anybody.
Now, let's get back to the eating disorders itself. It seems like there's a big predominance of eating disorders in teenage girls. Do you see that, and why do you think that happens, and what do you think we can do to help with that?
Okay, yes, I mean, there is a majority that it does hit the teenage girls, but we see a whole gamut of people of a variety of ages, not just for teenagers, but I think teenagers are the most vulnerable because they're going through a phase in their life where they're really trying to get some autonomy. They're really trying to develop a sense of self. And then we get all of these external influences through media, through magazines, through various outlets that kind of show them or give them the message that in order to be happy, successful, accepted, you have to look a certain way. And if you don't, then you're worthless. And that's so much of the messages that our teens are getting. And that's why they are the most vulnerable for eating disorders because of that. Because you have to understand is that what's at the core or the root of eating disorders is not so much, sometimes it's just about body image, but again, it's the body image difficulties that they have is a manifestation of something that is quite underlying that and quite severe as far as low self-esteem, low self-worth, trauma, bullying, all of these things that have made them feel terrible about themselves. So they see these external factors saying, do this and you'll be happy, do this and you'll feel better about yourself. And that's where they get into the trap of eating disorders because, especially with anorexia, is that they want to desperately feel better. And then they start to restrict themselves, thinking that if they change the way they look on their outer shell, they're going to feel better about themselves inside. And what happens is that does not happen. And they fall into the rabbit hole of getting a disease that is going to take over their mind and cause them to do things and act ways that they never thought that they would be doing.
And they get stuck in the circle. You know, they're anorexic, they've been doing this, they feel that that's the only thing they can do. They're looking at their body image being so poor, and without, again, the multidisciplinary team that we have at a place like Robert Wood Johnson University Hospital, Somerset, including the psychologic evaluation, including the occupational therapy, including just a plain nursing care, the being ability of saying, yes, you've done it, those words, the handshake, the hug. Of course, during COVID, we can't do as much of that as we'd like to, and I'm sure that's not helping, that you can't give them that hug or that handshake, but those emotional things make a big difference. And, you know, the young teenage girl who sees, you know, the runway models, and they're afraid that if they gain 1 pound that they're not going to be accepted, it makes it very, very difficult for them. And then they go to college, and it's even worse in college with the peer pressure from their sororities, you know, and saying that they have to look a certain way.
Correct.
Now, other than teenage girls, are there other groups that we have to look at?
As I said, I mean, eating disorders is not just exclusive to young women, it's also men. We're seeing more and more men seeking treatment for eating disorders than ever before. I don't think that it's increasing. I think that it's always been there, but men have kind of just stayed behind the scenes thinking it's a female illness. So they have not sought treatment as much as they should have. But we're seeing more acceptance with males to seek treatment. So that's also increased. Also too, people going through a crisis at any point in their life. We see patients here that are in their middle ages, developing eating disorders, and they never had issues before because they go through their midlife crisis, or they go through a trauma, or they just feel that something's going on in their life they can't control, and they're desperately seeking that control in their life, and they just fall into controlling the food. So really any age group is vulnerable to an eating disorder.
Which again, especially in men usually don't go to a doctor or anything unless their wife tells them to do something. So if they won't go for their prostate test unless their wife says you need to go to the doctor and get your prostate test. They won't go for their colonoscopy unless their wife says it's time for your colonoscopy, and they have to actually schedule it for them because they'll tell the husband, schedule it, and a month later it's still not scheduled. So the wife thinks that her husband may have an eating disorder, or anyone in the family. Maybe they've got a newlywed, and the newlywed, son or daughter is thinking about having kids, and they're afraid of what's going on with their dad. What should someone in the family seek or do if they suspect that there's an eating disorder?
First, talk to them. And I think that's the most important thing, and express their concerns. The second thing would be to talk to their primary care physician also, and have them go in and get some lab work done and some, medical screening. And then also, hopefully they would be agreeable to see a therapist to be able to talk about those underlying issues. I think those are the first steps. If it is discovered that the patient really is in medical danger or there's medical issues, then it would be to come and call us up, have evaluation, because it probably sounds like they need a higher level of care than just an outpatient therapist and a PCP.
So again, that's even for the teenage girl who you're afraid may have anorexia. The first thing to do is get them, either him, her, over to their primary care doctor, do a medical evaluation to ensure that there's no medical issues that may be causing the eating disorder. And then see if there's a way to help talk about it, whether the person actually is willing to say that, yes, they do have such a eating disorder. 3 is then to seek a evaluation with possibly an outpatient psychologist or therapist or psychiatrist, see if they can come to terms with it as an outpatient. Then if that all fails, then seek help over at Robert Wood Johnson University Hospital Somerset's Eating Disorder Center. Is there a telephone number for them to call, for screening at the Robert Wood Johnson University Hospital Somerset for a family member to call or a patient to call?
Yes, there's a 1-800 number on our site. They can just, Google our eating disorder. Everything is set on the network. There's a 1-800 number. They'll call the Access Center. They'll ask them a few questions and schedule an evaluation.
Now, at the eating disorder program, I hear that they're starting some renovations. Can you tell us about the renovations, what it means?
We are so excited, especially for myself, who's been here for so long, to see what our program is going to be. Yes, we are doing major construction and major facelift to our eating disorder program. We are going to have 2 separate inpatient programs when we're finished. We will have a separate programming for adolescents, a 10-bed facility for just the adolescents, and then we will also have a separate program, a 10-bed for adults. So we can really hone in on the individual and specific needs of each of those populations. The whole unit is going to be updated and renovated, and it's going to just be beautiful. We're also doing the same in our partial program. We're going to have 2 separate programs, one for adolescents and one for adults, again, to be able to address the special needs of each of those populations. So we're incredibly excited about where our program is going.
So what we're doing is we're innovating the innovated program.
You got it.
And what we've learned is that leadership at Robert Wood Johnson University Hospital, both at New Brunswick, Somerset, understand that eating disorders is something that needs to be addressed. And we've been doing it very well with the current status, but we'd like to do even better. So we're going to renovate and improve it even more.
Absolutely. We're so excited.
We also understand that at the eating disorders, the complete gambit of professionals is important to get the person through their eating disorder. You know, the fact that we have a occupational therapist who's got her own sights on this and really enjoys the work she's doing and helping us with specific type of eating disorders that probably very few others programs do. It's great to have people like her on board.
Yeah, and it's definitely really rewarding. One thing I did want to mention that also makes our hospital special, as Lynn was talking, I was reminded that people deal with all sorts of issues that can be the underlying reasons for their eating disorder. And that includes gender identity related things. Robert Wood in Somerset is actually a proud facility, which means we have extra special resources for those in the LGBTQ community that might also be experiencing eating disorders.
Robert Wood Johnson University Hospital Somerset, their leadership, their physicians, their nurses, their full staff, janitors, clerks, everyone involved is part of the team. The fact that we do have the Proud program for the LGBTQ community is wonderful. There's very few other places that have the resources that we have. And the fact that they're interconnected with the whole university hospital makes us even more special to both the LGBTQ community as well as the regular community. And we're able to integrate it throughout the whole gambit of services that are available through both outpatient and inpatient Robert Wood Johnson University Hospital. It allows us to have programs such as your eating disorder program. Well, again, as you said, one of two in all of New Jersey that really sets us aside from the other programs and the other facilities in New Jersey. We're a community-based hospital that has expertise in things that the other hospitals throughout the state don't have. It has you, Lynn. It has Jill. It has the whole gambit of people. It's got the psychiatrists, the psychologists, the speech therapists. It's got things that very few other places have, and that we've got them all connected within each other. So as a last thought, we'll first start with Jill. What do you want to tell the studio audience about eating disorders and what we have at Robert Wood Johnson University Hospital, Somerset?
Just a takeaway message is just remember that eating disorders don't discriminate. They don't have a certain look to them. You can't necessarily tell from the outside that somebody is struggling with an eating disorder, and they're not always related to body image issues. Look out for yourself and your loved ones, especially during the pandemic. This is bringing a lot of increased mental health concerns to the surface right now. And just know that we're always a phone call away.
Thank you, Jill. And thank you for everything you do for the program. Lynn, last words from you also.
We're able to be able to meet all the patient needs, no matter what is going on with them medically, psychologically, and that not to be afraid to seek treatment. Eating disorders can be a very scary process for people to go through, but they do not have to go through it alone. We have so many people here that will support them and help them. It's kind of like, reach out your hand, we will grab it and we will hold on to it for as long as you need us to hold on to it, and until we can kind of set you off to be able to do it on your own.
Thank you both for being here. Thank you for everything you do for our community. Lynn, thank you for your 19 years of service, and we hope for another 19 years from you.
Absolutely.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset's Eating Disorders Program, please visit our website at www.rwjbh.org/Somerset.